I'll talk about insurance and bariatric benefits. Just some things that you need to know as you're preparing or considering to having bariatric surgery. I want to welcome you to tonight's support group, and at the end, we'll take questions. Okay. First thing you need to be aware of or take and consider is, are you a candidate for bariatric surgery? If you have a body mass index of 40 or greater, you are a candidate in relationship to insurance. You've been unsuccessful losing weight, even when you've done diet or exercise. Most everybody has tried multiple diets, done different things. They may lose some, and then when they stop, they gain it back. So you have attempted to lose weight. This isn't your first attempt by coming to see us. If you have a BMI or body mass index between 35 or 40, most insurances are going to require one or more specific health problems. And then there may be those of you that have a BMI below 35. The majority of insurances will not pay unless you have a BMI of 35. So you would be considered as a self-pay patient. So what are the specific health problems that you would need to have if you're less than a BMI 40? Most insurances are looking at obstructive sleep apnea. That's when you're having problems sleeping, you're wearing a CPAP at night. If you are type 2 diabetes, if you have uncontrolled hypertension. Now, it doesn't mean that if you have high blood pressure and you're on one medication, the majority of insurances are going to require somebody to be on more than one blood pressure medication. If you have hyperlipidemia, if you have coronary artery disease, or non-alcoholic fatty liver disease. Now, there are others. These are the ones that pretty much are the majority of what insurances that are consistent across the globe. But some insurances will give you more ranges, and so that gives you other opportunities if you have others. The majority of our patients have more than one of these right here when they come to see us. What are other specific requirements? Well, for insurance and for our program, some insurances will allow you to be 18 years of age. But for our program, 21 years of age or older, and we go up to age 69. Now, if you're 20 years old and you're starting the program, that's fine. We just will not do surgery on a patient until they're 21 years old. Your insurance and your surgeon is going to require a referral or a clearance letter from your primary care provider. We will not be managing you medically if you have sleep apnea, if you have hypertension, if you're diabetic. So we want to make sure that your primary care provider is aware that you're considering surgery and they feel like you're a good candidate. You will also have a dietary assessment. We have a dietitian that's with us, Ginger Mark. Not only is she a registered dietitian, but she also is a certified diabetic educator. A psychological evaluation. Again, that is a requirement for our program, but it's also a requirement for all insurance companies. And it's basically a clearance for bariatric surgery. If you have any kind of problem that's going on or something that needs to be addressed, some of our patients need counseling before they have surgery. But if you have an outlying issue that needs to be addressed, whether it's health or psychological, we need you to be at your best when you have surgery so you can be successful. If you're diabetic, we want your A1C to be 8 or less. If it's higher than 8, the surgeons are going to want you to be seeing your primary care provider, an endocrinologist, somebody that can get your A1C down. Again, like I said, our dietitian is a certified diabetic educator. She does a great job working with our patients. One thing that goes without saying, no net weight gain during your preoperative process. We've had patients to come see us, and when they're going through their visits and seeing other specialists, they come back to see us, and we've had some to gain 15, 20 pounds. The insurance companies aren't going to look at it as you are taking it seriously if you are gaining weight while you are going through this process. Now, understandably, you've got a little bit of wiggle room as far as if you gain, a few pounds or something like that, but insurance companies will deny when we submit your records for review if they see that you have gained weight during the process. And this isn't a requirement for our program, but some insurance companies require you to have so many visits, monthly weight management visits, before you have surgery. So the program doesn't require it. Some insurances don't require it either. But state employees, they have 2 options. They require you have 3 monthly visits in 90 days, and not only for three visits with the nurse practitioner or the surgeon, but also once a month to see the dietitian in those 3 months, and then to visit with an exercise physiologist that's in our program. And then the other option that state employees has is 6 consecutive months, and which is 180 days. So once you decide you want to pursue this, we either know what your insurance requirements are, or we will verify it. And then some insurances require you to have a documented BMI history. I know for hospital employees and for state employees, you have to have a 24-month BMI history that's greater than 35. There's many of them out there that do not require that. But like I said, since it's not like your gallbladder and you're having problems, and it's pretty much the criteria is consistent across the board with the insurance companies, they all have an option of deciding what criteria they want to set. Some insurances have a 5-year BMI history. There's not that many anymore, but some do. The insurance carriers were always asked, what insurance do you accept? This is pretty much the list of the ones not only that we accept, but the ones that do pay for or have bariatric benefits. Now, each state has their own Blue Cross. So if you work for Toyota, you have Blue Cross Anthem. And if you work for a teacher, if you're a teacher, a state employee, you've got a different Blue Cross. So each Blue Cross has their own criteria. And at the bottom, I've got a note, some employer-specific plans exclude bariatric surgery. So you can't assume that, my friend has Aetna and I have Aetna, so I have bariatric benefits. There are some employers that have that as an exclusion in their policy. So it may be included in the Cigna plan, but it may not be included in your employer plan. UMR that we have listed there, the hospital employees, it participates in it. And then like for the government programs, TRICARE, Champus, VAs, these will require a referral from your PCP. And then, there's Medicare, and then Medicare and Medicaid, and then the Medicare Advantage plans. And one thing that's, patients that have Medicare, have the Medicare Advantage plans, they assume that if they have a Medicare Advantage plan, they have the exact same requirements as Medicare, and that is not true. The Medicare Advantage plans have their own requirements, and they have their own, they require pre-certs, just like everybody else that is listed on this screen. The only one that doesn't require a pre-cert ahead of time is Medicare. But Medicare does have a policy in place that they follow very rigidly. And we have to dot our I's and cross our T's to make sure that the patient meets all those criteria, because they can and have asked for records after a patient has had surgery. And then insurance carriers that do not cover. It doesn't mean that we don't participate in these. It just means that insurance doesn't cover it. If you have Medicaid only does not cover bariatric surgery. If a patient has Medicare and Medicaid, since Medicaid coordinates and pays after Medicare, if a patient has Medicare and it pays, then Medicaid will pick up. Humana, whether it's the traditional Humana or Humana Medicare Advantage, the Tupelo, North Mississippi Medical Center and Health Services does not participate with Humana. So if you had Medicare and then you crossed over to Humana, Humana requires a patient to go through a process to complete a waiver. And the majority of the time, they're going to try to send you somewhere else to another facility that does accept Humana. Ambetter, while it is one of the marketplace policies, Ambetter does pay for bariatric surgery in other states. It is not included in the state of Mississippi. And then Mississippi Can is an extension or an option similar to Medicaid and Molina Magnolia, and none of these have bariatric benefits. So you looked at that list and you see that your insurance is listed there. We would have to verify specifically for your employer, but you're thinking, what do I do next? Well, you may know that you had one of those insurances and it's not covered. So wanted to make you aware that if you have no health insurance coverage at all, and we do have some patients that come through here, they may be self-employed and they don't have insurance. This is, what it would cost to have surgery. So from the time that you're in the hospital, you will be responsible for $12,500. This covers the surgeon, the anesthesiologist, and then the hospital fees. You have surgery, usually we do surgeries on Tuesday. You stay overnight Tuesday and Wednesday night, and you're discharged Thursday. So everything that takes place when you're in the hospital there, that is covered. Now, this only covers your hospitalization. So if you have no insurance at all, any appointments that you have to see the surgeon, the dietitian, the psychologist, if you need to have a cardiac clearance, all that is separate. That is not included in this package. And prepayment is required prior to surgery. All right. The next scenario could be you have health insurance coverage, but you don't have any bariatric surgery benefits. We've seen it both ways. We've seen it where patients do not have bariatric benefits, and the insurance will pay for the visits to see us. And they will pay for whatever you need to have done, whether you're seeing a specialist, because we're not doing screening. We will schedule you with specialists if you've got a concern that one of the surgeons feels like needs to be determined. Like if they think you have, if you say you have reflux, well, they're going to want to see you to see a GI doc because they want to know if you have reflux or if you have a hiatal hernia. Because if they're doing the bariatric surgery, they will take care of the hiatal hernia at the same time. And then we have insurances that if it has anything to do with bariatrics, if you're seeing us for anything, they will not cover it. So we would just, file your insurance, but you would need to be prepared to pay for your office visits if you do not have bariatric coverage. And you would apply to the slide before, you would apply to this right here. Now, the difference between you having insurance and the patient that has no health insurance at all, if you have to see any specialist, your insurance will pay for the specialist because you're being seen for something that you have signs and symptoms for. All right. The next option is the best option, which we hope, everybody can have, is health insurance with bariatric benefits. Now, the long list of things that I included at the beginning, that if you have these diagnoses, or if you have a BMI of 35 or a BMI of 40, everything that your insurance requires, we will send the records to them, and we will send it to be approved. When you come see us for your first visit, we'll give you a lot of information. After you see the surgeon, you will meet with the scheduler, and she's going to go over the specific requirements that you have, that the surgeon wants you to do, and then those that are required by your insurance. You will find out then if your insurance requires weight management, if you have to do 3 months weight management, or if you don't have any to do at all. So whatever your insurance requirements are, and whatever your surgeon wants you to do, you will have a checklist that you will be able to see that as you're doing these things, or as these appointments are scheduled, then you will know, you can mark off your list what you're doing. If you don't have state employee insurance and you're not doing the 90-day option, then you only have to see the dietitian once. So you can mark that off the list after you see Ginger. And then once you schedule your appointment and you are seen by the psychologist, you can mark that off your list. But if you need to see the pulmonologist because he thinks that you might have sleep apnea, you don't need to wait till the end of the process, because if the pulmonologist thinks that you might have sleep apnea, then he's going to schedule a sleep study for you. And then during your sleep study, when you're staying there and they're analyzing you, if they determine that yes, you do have sleep apnea, then they're going to give you a CPAP so you can wear when you sleep at night. And then it's kind of like anything else. When you try new medicine, the doctor's going to want to see how your lab levels are, see if the medication or your blood pressure, if it's got it in line. You'll have to have another home study or a sleep study to determine. They'll have to titrate it to get it just right for you. So if you come see us and you don't have to do any weight management, and we need you to see the pulmonologist, you need to go ahead and get that appointment scheduled, because if you're trying to have surgery before the end of the year, you need to go ahead and mark off those things that you're doing. Otherwise, you may be, postponing it or delaying it a little bit if you do have some of these other things. If you need to see the cardiologist, sometimes the cardiologist, they'll do an EKG, or they think you need do a stress test, or sometimes they're wanting a CT scan, and that doesn't all happen all in one day, and that varies by patient and what their signs and symptoms are. So we just want to make sure that you're kind of working at the pace that you want to go, if you've got a timeline that you want to have surgery. So when you come see us, we're going to tell you the worst case scenario. This is how much your deductible that you have left. This is how much your out of pocket you have left, and in your worst case scenario, this is how much you will be out before you go, before you come back and you schedule your appointment. Now, if you have a GI procedure, if you have a EGD, or if you have a mammogram, or if you have a sleep study, or if you have a test from one of the cardiologists, all those would reduce down your deductible or your out of pocket, because you will be paying that prior to you having surgery. And then the visit that you come in, which we call your check-in visit, you come in, you've met everything. I mean, you've done all the tests that you're supposed to do, or this is your last visit that the insurance is requiring you to do. Well, we will tell you, this is what it was on the first day, but this is how much you've got left now. So you're down to this amount right here. When it comes time for you to schedule your appointments, we collect for the hospital and we collect for the surgeon. So we will tell you what you need to be prepared for, as far as to be able to schedule your surgery. Now, we're always asked, sometimes when we tell patients that their insurance, they do not have any bariatric benefits, or this year we have seen that deductibles that are higher in some places, and the out-of-pockets portion is higher. Some employers are offering 2 to 3 options, and the option that the employee picks determines what their premiums are. So if you have a lower deductible or a lower out-of-pocket, your premium's going to be a little higher. So when you start picking what you want, we saw a patient today that he only had family coverage. He didn't have individual coverage. So instead of having just his individual amount being what he had to meet, he had to meet twice as much because he only had the family plan, not an individual plan. So insurance is confusing, and insurance can be complicated. And as you are picking plans with your employer, make sure that you're taking in consideration if you have plans to have bariatric surgery. We've seen this year some plans, the premiums are low. If a patient wants to pick one that is low, and then if they have to have surgery of any kind, then they have a buy-up plan for the period they are going to have surgery, and their insurance premium goes up for them to have this insurance coverage while they're have a need to have surgery. So there's all kinds of scenarios out there. But just make sure that when you are picking out one, that you take in consideration what your deductible is and what your out-of-pocket is, because that's going to impact you when you decide to have surgery. And one thing that we have been, working on this year is, for the patients that do not have benefits, or for the patients that have high deductibles. We've seen, out of pockets. We've seen patients with $3,000, $5,000, and $7,000 out of pockets amount this year. So when you have that amount that you have to be out, somebody's got to be pretty sick if they meet a $9,000 out of pocket. So patients will ask us, well, do you have any finance options, or do you have any, can I pay as I go? Because this is an elective surgery, that is not something that the hospital allow us to do, to set up payments on a payment plan. But we are in the process right now of working out an arrangement to offer care credit for the bariatric program. So if you find out that you don't have benefits, or if your out-of-pocket portion is more than you're prepared to pay, just reach out to us, hopefully within the next month, and we will have an option for you to offer care credit. So at this time, I'm going to turn it over and see if anybody's got any specific questions.
Okay, so one have a question. She said that she believed that she was told no checks are accepted. So you just pay by credit card only. Did you hear that question, Terry? Terry,
Yes, ma'am.
are you muted? Because
Okay.
you may be okay. But the question is, you can't pay with check. So what are your other payment options other than credit card?
Okay. Vivian said the question is, Vivian said the question is, if we don't accept checks and you don't want to use credit cards, what other options do we have? We've had patients that have come in with cashier's checks. If that is something you plan to do, if you want to take money out of the bank, I would just suggest that since we collect for the hospital and for the surgeon, you would need to have the specific amount known when you have the two cashier checks written. We do take cash. We do ask that if you do self-pay, um, not to bring in $12,500 cash. We would prefer for you to do something like the cashier's check for your safety and for ours.
All righty. Can you hear me, Terry? I apologize, but I'm
Any
just
other?
gonna have to call her.
Yes.
All right, so the next question is the referral letter due from your doctor? I'm thinking that they're meaning, is it due when they come for their first appointment, or when do they need that referral letter?
The referral letter process, you do not have to have a referral letter for your initial consultation. When you come for your consultation, we will talk to you and you can tell us like who you think you will use. There are many patients that just go to the doctor for urgent care. If you're a female, you can use your GYN. But if you're not established with anybody, we will ask you to establish with somebody so somebody can manage you medically. Now, those of you that your insurance requires a referral, TRICARE, VA, Champus, yes, we will need to have those referrals at the time that you come see us. Otherwise, and that should be initiated by your PCP. And your PCP, if you have TRICARE, you already have a PCP, a primary care provider, and they should know how to initiate it and get that fax to us. And one thing I didn't say, or I may not have been clear, when it comes time for your insurance, everything that they have asked for and everything that we've asked for, we submit that in chronological order and we provide that to them. We fax that to them, or some insurances are allowing us to upload it online. Those that do that, the turnaround time is quicker. But with bariatric, with them having requirements, they're going to want to review it and make sure, like I said, that you haven't gained too much weight or that your A1C is in um, good standing, and that if you do have sleep apnea, they will ask for a compliance report. So we will send a compliance report. So it's not that, okay, you've had your sleep study, you've got your CPAP, you don't like it, you don't want to wear it. They're going to want to see a compliance report. So, as long as you're using it 90% of the time at night or something like that, that's pretty good outcomes. So we will send all that to them. Some insurances will respond to us in 3 to 5 days. We have a few that when we submit to them, they tell us 15 calendar days. So with that being said, with us knowing that, when we schedule your surgery, we're going to know that we need to extend it out a little bit to have enough time for your insurance to make a decision.
I'm trying to figure out why you can't hear me. So click right here on the chat. Right. So, and it'll show what she's been diagnosed with sleep apnea, and she wants to know if she will need another sleep study because currently she's not using the machine.
Okay. All right, somebody has a question. How do you determine the 2 years of BMI records? If you have been to a physician or if you've had an annual exam, anybody should be weighing you. If they ask you what your height is, then when they enter that into the computer, it will calculate what your BMI is. We have seen patients that they're they have been asked what is their height, and their height may be we will measure you to get an accurate height. So we have had some patients that might be an inch or two document an inch or two taller somewhere else. When we get your records, if your height is incorrect, then we mark through it, put an accurate height, and we use the printout from a BMI calculator that shows what your accurate height is. If you've been for a job interview, if you've done a wellness visit, anything like that, that is documentation of what your BMI is. I think we had another question. Yes, ma'am. Okay. Okay. One question was, at the time that you come for your check-in appointment, do you need to be prepared to pay for that visit? At that visit, we will tell you what your out-of-pocket portion remaining for us to schedule a surgery date. We have patients that call us maybe the visit before, and they're asking, can you tell me how much I need to be prepared for? So we'll be more than happy to tell you before you come to your visit or at your visit, at least from that. And that will give you, like, how to plan for when you want to schedule your surgery. And I see that there was somebody said, I've been diagnosed with sleep apnea, but never had a machine. How will I have to do a sleep study again? You would need to talk to the pulmonologist that you have said, get back in with them. They will probably, with you being diagnosed with it, they may just give you a new order for your CPAP machine, and then have the results from that. Okay. What was the date? Okay. Okay. When you come in for your visit, for your check-in for October, we will tell you available dates. Both surgeons do surgery on Tuesdays. On months that we're getting closer to the holidays, they will add some Thursday dates. But on that date when you come in, we can give you a date. Okay. As far as As far as care credit is concerned, we are in the process of making that contract with them, with the hospital. If you want to give us a call by the end of the month, we'll have more information about that and the different options that we'll offer. We will also put it on Facebook, in the newspaper. We will make it public that we do have that option for financing. Okay, I think I answered that one. We are very diligent with reviewing the requirements for the insurance companies. If you have the diagnosis that they require, you have attended your visits, you're, like I said, if your A1C is, 8 or below, very rarely do we have anybody that gets denied. We tell you up front what you need to know and then what you need to do. And I'd say 95% of our patients that we submit are approved. If they are denied, it's asking for additional information or for the surgeon to have a peer-to-peer with their physician, and it's a clarification of a note, and then it's usually turned around from there. And one thing that they do require, and we do as well as our program, and I didn't put that on the slide, non-smokers. If you are a smoker, when you come see us, your insurance is going to want to have a nicotine test showing that you are negative. And the reason why the surgeons push that is because it helps you with smoking will hinder your healing process. And with you having the large portion of your stomach removed, you don't want to have any complications for healing. So tobacco free is the answer if you're considering having this surgery. And I know like Federal Blue Cross, they are real strict on it. If you are a smoker, you have to be tobacco free 6 months before they will approve your surgery. The others aren't like that, but Federal Blue Cross is.
Okay, so the next question, Terry, I answered that one. It's regarding cardiology, gastro, your different preoperative clearances. They wanted to know that if they ask you several questions and they feel like they can't find anything wrong, even though we ordered their procedure. So we order, just say cardiology or the GI doctor based on symptoms. So cardiology will give a surgical clearance. So meaning that if they feel that based on your history, family history, or current ongoing issues, if you need a treadmill test, if you need a echo, they determine that at that visit. And then they will send a letter to the surgeon giving a letter of clearance and possible cardiac risk as you proceed with the surgery. For the upper GI, of course, if you are depending on your age and your family history and your history, you may be required to have a colonoscopy, and that's a preventative test. And also the upper GI, the surgeon is going to be taking part of your stomach away. So he would like to know to make sure that if you have a hernia or if it's anything there that he needs to be aware of prior to doing that procedure. So it's not necessarily that if they don't find anything wrong. So, it's just like even if you went to pulmonary and they did your assessment in the office and it was found that you didn't have any issues that warranted a sleep study, and then that would be the end of that visit. You just wouldn't have to have a sleep study. So it's for an assessment, and then the actual consulting member, cardiology, GI, they will determine the next step. All right. So the next question. Okay, so once I'm able to schedule a date, how long does it take to get an actual date? Which I think when they come for the check-in visit is when they'll schedule the date. So she wants to know, so for instance, if she expect to be able to book a date within a couple of weeks, or would it be a month? Like how far out or how early can you schedule?
Right now, we're booking, we have flexibility. We're booking in the month of August and September. If it's something that you're interested in having surgery later, or your completion of all your requirements is toward the end of the year, we may not have as much flexibility. But that also will be in the month of November, December. That's when I said the surgeons add extra days. So let's just say, for instance, you've got an insurance that requires 3 to 5 days from approval, then you should be able to have your surgery within 2 to 3 weeks. Because one thing that you have to take in consideration is you will be on a 10-day diet prior to your surgery. So it's not like you see us today and you can have surgery next week. Um, we can see you today and we can have you to start your diet, and you may have your surgery in 2 weeks, but you do have a 10-day diet that will be discussed with you at your check-in visit, and then at your pre-surgery education class.
All right, so I'll answer this question. The next one is this patient was diagnosed with sleep apnea in January, and she wanted to know, will she need to bring information from her doctor to verify that? If you're currently using a CPAP device, then you will be required to bring us a CPAP compliance. Most machines now, the newer ones, you can actually pull it up online yourself and print it out. But if you have one that has a chip, then you can take that to your DME company where you get your supplies from, and they'll be able to print you out a 30-day compliance. And on that 30-day compliance, it's important that you have a usage of greater than 70% where you use the machine greater than 4 hours a night on a nightly basis. Because if it's less than 70, most insurances will not honor that. It needs to be greater than 70%. So that's at least a nightly usage of greater than 4 hours.
Any other questions?
Okay, so this is not an insurance question, but they want to know how long is the recovery. She's kind of trying to figure out the time she would need off of work. So if you have depending on your job, if you have a sit down job, clerical type things to where you're not lifting greater than 10 pounds, generally you can go back to work in a couple of weeks. But if you have a strenuous job and you're lifting over 10 pounds, then it would be at least 6 weeks. And also no long travel for 6 weeks after the surgery. All right, so the payments that are paid to your specialist, cardiology, GI, will that be taken off of the final bill at the bariatric clinic?
Yes. When we tell you, like, this is how much you owe on the day that you come to the clinic, then we will look at your deductible and out of pocket that you've already met, and we will say, this is your new amount. Because as you're having other tests and other studies, that will be going towards your deductible, and then that will come off of it. It will reduce the amount that you would be paying for your surgery. And toward the end of the year, or the last 3 to 4 months of the year, there are patients that have met all their out of pocket and all their deductible, and they don't have anything remaining to pay for their surgery. So there are, depending on the time of the year, or if a patient's had other things going on beforehand, that their amount is minimal.
Okay, all right. And the next question is about the diet. I answered that. They wanted to know, depending on your BMI, do all patients do the 2-week diet? And the answer to that is yes. The purpose of that 2-week diet is not necessarily to promote weight loss, but it's given to you so it can shrink your liver. The stomach is located underneath the liver, and that's where they're going to be operating. So they want to make sure that you do that diet, a combination of liquid and high protein, low carb, in order to shrink the liver. Any more questions? Okay, so this is about the psych exam. If it's not covered by insurance and you pay out of pocket, does that go towards your final bill?
If it's not covered by your insurance, then it will not reduce the amount of your bill.
Okay. Any more questions? Okay. All right, so one of the patients or pre-surgery patient wanted to know because she does home health work, but she really doesn't have to do a lot of lifting. So with some home health jobs, if you're traveling all day long, that's something that you would really need to be off 6 weeks, especially if you're doing home care and you're alone. Because of course, when something happens with the patient and you have to take care of the patient, you really can't determine whether you're going to have to lift 10 pounds, more than 10 pounds or not. So more than likely, it will be 6 weeks. Any more questions? Alrighty. Okay, so this person has a BMI of 36 and wanted to know if they fall below during the 2-week diet, will the insurance deny?
No, because we have already submitted to them and it's been approved. So your BMI will not be shared with them at the time that you have surgery. We will go with your pre-op visit BMI and weight, but you will already be approved before you start your diet.
All right, and a second question from the one about the psychological examination and the fee. If your insurance do not have benefits and you have to pay out of your pocket, the only way to actually find that out, you would need to call that site provider, in which we will give you all that information when you come for your new patient appointment with the contact number and everything.
Yes.
That way you can get your insurance verified to see if they accept your insurance, so you'll know what you will be responsible for. So, in which one person said that it was 488, it was quoted for her today. So I'm not sure if that's just individualized or just a universal. So I would call just to double check based on your insurance. Sometimes people can be in network and some people are out of network. So if you're a self-pay patient, do you receive the same care? And I will say yes. It's no different. It doesn't matter. First of all, the surgeons, they have no idea what kind of insurance you have. They have no idea if you're self-pay or insurance, none of it. And they could not tell you the criteria for your insurance because that's not what they do. They're the surgeon and that's what they're going to do is take care of you. So it doesn't matter whether you're self-pay or insurance, you're going to get the same care. You still follow the same program regardless if you're self-pay or cash. this is about your health. So it's not, I'm going to do this for you because you're paying cash, or I'm going to do this for you or not this for you simply because you're filing insurance. It's universal, the same care regardless. All right, so if something is not covered by your insurance, can you get a different referral? So for instance, just say the psychological examination. The site provider is a bariatric site provider, and that is required. The majority of the time with insurances, it needs to be someone who deal with bariatric patients and give the correct testing material. So you would have to see the bariatric site provider, regardless of whether your insurance, cover it or not. Now, as far as counseling post-surgery, post the examination, if they require that, then we could try to work with you to find someone that was in your network, and they would also try to help you find someone in your network. That can be done, but the initial will have to be done by our site provider. I'm not sure about what is meant by the requirements to be covered, because I'm really not sure if you're talking about psych or just the overall procedure itself. So if you could clarify that, and I'll try to answer.
There is one that says, is a psych exam required by the insurance company to have bariatric surgery? And yes, it's
Okay.
required by the surgeons and by the insurance companies.
And we are accredited, so that's also part of our accreditation. Okay, so on various visits, was told that things were covered by insurance, then was told last week that it wasn't covered by insurance. I'm really not sure if you're referring to one of the specialists that you were referred out to, or benefits as far as having bariatric surgery. So if you could clarify, maybe we could answer that question. All right. So, and I'm assuming this is speaking of the psych exam, they wanted to know if it was required, why would the insurance not cover it? But it's kind of like bariatric surgery is an elective but necessary surgery to improve your quality of life and your health. But if the company you work for do not have benefits, we can't do anything about that. And it could be life or death. You really need this surgery in order to improve your health so you can live another 10 or 20 years. But if they don't have benefits, that leaves us with the option of we can't do anything, because we have to have a criteria to go by in order to qualify you for the surgery. And as far as a different place for the psych exam, you would have to use the one that we refer you to, which will be Delta Autumn. Any more questions? Of course, if you have questions and you would rather call and speak with someone personally to discuss your question or whatever issue, feel free to call us 662-377-7546, and we can answer your questions. Okay, I think that's it, Terry, for the questions.
All right. Thank you.
I appreciate everyone coming out for the support group, joining in, taking the time. So hopefully we'll see you on the next one. And like I said, if you have questions, please call the office and let us know, and we can try to help you as best that we can. Have a good night.